Can you tell the students a little bit about what to expect regarding their clinical sites?
Your clinical site assigned is your site for the entire program. No switching, swapping, bargaining, or begging is going to change your clinical site. You'll get these clinical site assignments closer to time of the in-person orientation. You'll likely be at a different facility for psych and pediatrics. Some of you may even be at a different site for OB or critical care. When you're at your clinical site, whether it's for testing, clinical, or time in the skills lab, you're required to be in full UTA uniform, which includes your UTA ID. With the exception of testing and Senior 2 courses, you're not to be at your clinical site without your clinical instructor. If you're a partnered student and you work at the clinical site, you can't use your Prox card or your employee log-on for any computer access or anything similar while you're in the student role.
How about clinical days? Can a student request to be in a Saturday-Sunday group for the entire program?
Your clinical days are going to vary from semester to semester. If you're in a group that's Saturday-Sunday for the first semester, there's no guarantee that that is going to be your clinical assignment for the remainder of the program. Other courses, psych, PD, OB, community, capstone hours are often during the week. Flexibility is a big part of this program, so make sure you let your employer know that they'll need to be flexible with your schedule. We'll try to send out your clinical days about 30 days prior to the start of the term. Clinical days, including orientation, are mandatory and non-negotiable.
Can you help the students understand a little more about what the next 16 months are going to look like?
This is your life for the next 16 months. Dates at the top are on Mondays. These are your courses listed for Junior 1. In Junior 1, you have 3 courses. One, Health Promotions, is didactic only. The other 2 are didactic and clinical, Foundations and Assessment. The X's that you see on the grid mark the clinical weeks. You will have either 1 or 2 days of clinical during each of these marked weeks. We'll talk more about that in the in-person orientation. You can see that the breaks between the semesters are very, very short. During these breaks, you still need to be available to complete paperwork or attend orientations, and you definitely need to be checking your UTA email during these breaks.
One question that always comes up, what about vacations, babies, and weddings?
There's no guarantee that you might not have some sort of requirement between the semesters or the terms. You'll need to meet these requirements in order for you to complete your clinical for the next term. So we don't recommend that you make plans without checking with us first. This includes weddings, vacations, elective surgeries. So check with us first before you make any of those plans.
During Junior 1, how will the students know if they're going to be in the skills lab or in the clinical setting?
The Junior 1 grid is specific to your clinical days and times. There may be adjustments that need to be made specific to your clinical site, whether it be availability of the lab, etc. So make sure when you're planning that you're using the Junior 1 grid that we sent you, not the one that someone else has posted on Facebook. Your clinical days may vary, so your dates and your instructor's instructions may vary as well. Your grid will have dates across the top. Although we try not to make changes once these are sent to you, they are subject to change, as is the progression chart that we talked about previously. Clinical days are days that you'll be on the patient care unit. Lab days, you'll be in the skills lab. Skills lab may be on site at your facility, or it may be located somewhere else. We'll tell you the location of your skills lab on the day of in-person orientation. The first week, you only have 1 day of clinical, and this is for the Junior 1 term specifically. You'll notice on the Junior 1 grid that there's also a makeup day. This is not a makeup day for voluntary absences. We'll talk more about the makeup day in person.
Tell the students why we are so crazy about clinical compliance dates.
So clinical compliance, very important. Prior to your clinical rotations, we are required as a school to send proof to our clinical facilities that you are up to date on your immunizations, your CPR, your background checks, your flu shot, etc. Some of them require the actual dates, and others may even require the original documentation. Most sites require this information about 30 days prior to the start of the term. Some sites require it much earlier. If your information is not received by the deadline that Ms. Webb or Ms. Whetstone post, it is a possibility that you may not be able to complete your clinical for that term. That will delay your program completion and your graduation, and we don't want to do that. So make sure you're very aware and you comply with all deadlines that we impose.
How is clinical affected when a student has an injury? When are they allowed to return to clinical?
If you sustain an injury and are returning to clinical from a surgery or delivery of an infant, you must have a note releasing you fully from your physician or care provider. If you have any restrictions regarding how many pounds you can lift, or if you are required to wear some sort of device like a boot or a cast, you must let us know so we can make sure that it's okay for you to attend clinical. Some facilities have limitations on students if they are wearing a boot or wearing a cast. But just check with us and we'll verify that information.
What happens if a student has to sit out for a term?
If you're unsuccessful in the clinical portion of the course, you'll be required to take the didactic and the clinical course again. Similarly, if you're unsuccessful in the didactic part, you're required to retake the clinical as well. In this program, each course is only offered 2 of the 3 semester terms. So if the course you need is not offered the next term, you may have to sit out a semester. So I hope that answered all your questions. I'm sure it didn't. So if you have other questions, please write them down and bring them with you to the in-person orientation this summer. If you need further clarification, my email is roye@uta.edu and Ms. White's is plwhite@uta.edu. And you know, as always, you can ask Ms. Webb. She does know everything. And that goes for you too.